welcome once again to another episode of From the Heart. As always, the show is brought to you by your American Heart Association and by the West Virginia Library Commission. I'm your host, Kevin Pauley, Marketing and Communications Director for the American Heart Association. Well, when you think about the work of the American Heart Association, most of the time the default thing you think of is the research that we do and the fundraising that we do, and events such as our annual Heart Walks and our annual Heart Balls, and even the work that we do in schools with the Kids Heart Challenge and American Heart Challenge. But did you know that a big part of the work that we do, both locally and nationally, revolves around the concept of working in the field of legislation and policy? Believe it or not, many things that are in play right now in this state, things that benefit your health, were put into play by work from the government relations teams of the American Heart Association. And here to talk more with us today about that is our government relations director herself, Emily Hanna. Emily, welcome back to the show.
Thank you, Kevin. Thanks for having me.
We're glad to have you. I know we are going into the legislative session, so this is your busy time.
It is.
Now, obviously, you know, we've talked about the fundraising stuff that we do on the show many times. We've talked about, you know, the science, the research, and the education. But I do think it's interesting to look at the policy side of things, because a lot of people just don't realize that we do have an active role to play when it comes to public policy, especially policy that can impact health.
Yes.
So talk a little bit about the position itself, the concept of government relations, and how that pertains to a nonprofit like the American Heart Association.
Sure. So we are a nonprofit, a nonpartisan entity, and so our goals are to advance the policy priorities put forth by our research teams for heart health, for stroke health, and so the American Heart Association is unique in that we feel very strongly about having a government relations director in all 50 states.
Right.
Having someone who knows the needs of the state, who knows the health concerns of the state.
Boots on the ground, if you will.
Boots on the ground,
yeah.
Exactly. And so we have the advantage there in having folks in all 50 states that work directly with our partner organizations, with our medical professionals, and with our legislators. And so the government relations director role, we work largely at the state level during the legislative session, but we also work at the local level with county commissions, public health departments, city councils to advance our policy goals there.
Yeah, I know it's so important when you think about, like, again, like here in West Virginia alone, like I know we've seen like the CPR in schools plan go into play.
Yes.
And we'll talk about your big win from last year with CERPs. You know, we now have the pulse oximetry bill so that every child born, even though you think it would be something that was just normally happening, it was not until we passed this, but now every child born gets a pulse ox test just to make sure that blood flow is good, because that actually can pick up a congenital heart defect, which is, again, a critical thing to have. You know, there are so many things in place, like, you know, even like the ability for communities to use their schools for like after school like activities for just the community, you know, the ability to have that, especially in our more rural areas where they don't have a lot of, like, they don't have a Planet Fitness every corner. They've got the school, and now that thanks to that, they are able to be at that school and use the facilities to do things like exercise and just get healthy. But these are all things that went into play because of the work that we do in that realm. So when you look at, you know, looking at a statewide, you know, plan. So how do you come up with, like, what are going to be your topics for each year for the session? You know, and what are, like, how do you find your focus, I guess? I mean, obviously you are in West Virginia, so you know the issues, but how do you look at that from the state level and with the local level? Yeah,
that's a great question. So we are uniquely positioned in that we have a robust research team that is working with scientists, working with medical professionals across the country to identify best practices for cardiovascular health, for all of the issues you mentioned. And then we are fortunate as government relations directors in each state, we get to choose by working with their local folks, by working with legislators who might know what's going on in their local communities, by working with educators who say, hey, we really need support in this area, by working with mayors or county commissioners to say, hey, our rural health is difficult. We're lacking in this area, or we have a lot of need for this. And so we use that science and research, and then we work with our local folks, and then we adapt the policy goals depending on what our specific needs are.
Now, I think it's interesting that you're able to work both on the local and the state level. Now, I do also know that we have like a national, a national lobby day at Congress each year too.
We do.
Like, how does that work when you're looking at taking, I guess, I guess maybe more what are usually considered a more hyper-local policy, and trying to work at that on a national level. Like, what are some of the things that they're taking on that scale?
Yeah, so this year our federal team, they are an amazing group of folks.
Oh, they are, yes.
Yes, and so they had a big win this past year, the end of last year, beginning of this year, where they passed the cardiac emergency response plans at the federal level.
Wow.
And so that opened up the ability for the federal government to fund and support the state and local governments in adopting those cardiac emergency response plans that we worked on here last year.
Yeah.
So sometimes our federal team takes on different issues than we might have at the state level, depending on what's going on at the federal government at the time. But we're awesome to work collaboratively, and we keep each other informed so that we're working in unison across those different levels of government.
Well, and with CERPs, like that was such a great way to kind of like work on national and state level, because like that is something that everybody can benefit from, right?
Yes.
Like that's not just a high level kind of thing. That is going down to like the absolute like hyper local, aspect of it, which I thought was really, really great, honestly.
Right.
So with that being the big win from last year, let's talk a little bit about that. So CERPs, or cardiac emergency response plans, when you're not using the acronym.
Yes.
These are, you would think that this, there's a part of me that feels like the common sense of like this should already be in play, but it's amazing how it's absolutely not. So like, it's great to see it coming together. So talk a bit about what this plan is, what it looks like, how it works.
Sure. So West Virginia was actually ahead of many other states.
We were in this, yes.
having some provisions in place for athletics and athletic departments in our middle and high schools. We had unfortunately had some of these cardiac events in schools before, and so our legislature had wisely worked to get some practices in place. But when you have responsive policy, sometimes it's not as comprehensive as it needs to be.
Sure.
And so we saw with the American Heart Association when Damar Hamlin had his cardiac arrest.
Yeah, that was, I mean, talk about a major lightning bolt time.
Yes.
Like, that was like, it was interesting because I remember seeing it all go down, and the next day, like, you could just feel like there was, it had sparked something, man.
It did.
Like, it really made people start thinking about CPR.
Yes, exactly. Because to the NFL's credit, and for all of the folks on the field that day, they did exactly what they were supposed to do and saved his life.
Right.
And so what we saw and what Damar saw in partnering with the American Heart Association is, hey, this doesn't just need to be something that happens at the NFL with all of our resources. This needs to protect every student in every school. This needs to protect visitors, grandparents, parents, staff. And so what we did last year is we worked with the legislature to expand our already existing provisions to make sure that we have the best practices for these cardiac emergency response plans, which is basically a written document, and it's tailored to each specific school.
Okay.
Because each school or each athletic field has different needs.
Sure.
You know, the population of the school is different, the size is different, the layouts are different.
And even like access to hospitals and such, like, that's a big deal too. Sure.
Exactly. And so what we ask these plans to do is exactly that. Identify your local hospital, work with local EMS, identify which door the EMS will use, identify who will call 911, who will initiate CPR. And a big part of it is having an AED on site.
Yes, goodness.
And also knowing where the AED is, how it works, when was the last time the battery was checked.
Yep.
Because a lot of times we have these great intentions of having an AED in the school, but maybe it was positioned behind a door and nobody could find it.
Nobody could find it, right.
Or maybe the one person who was trained on it is
Wasn't
absent
there that day. Yeah, that's it's simple things like that.
Yes.
But man, it sounds like this basically creates like a chain of command,
Exactly.
right? So everybody knows who's doing what, so that there's no overlap, no miscommunication,
Right.
and everything fires off like it should.
Yes, and one of the biggest pieces here in West Virginia and across the nation is making sure that that plan is practiced.
Yes.
Just like we have fire drills.
Right.
Just like we have other drills in our schools nowadays. We want this plan to be practiced because a plan is only as good as the ability to perform the functions in the plan.
Right.
And so we had wonderful input from educators, from PE teachers, from the Department of Education saying, well, here's what we see and here's is what we need, and just making sure those plans are available, practiced regularly, and all of the components are checked so that if they need to make adjustments, they can. And so we were really grateful to the legislature, to the governor, to our advocates who came out last year, and we unanimously passed that bill. And we're seeing the changes made in school. I've talked to some coaches.
Great.
Yes, who are making sure their AEDs are working and are properly placed. And so this year we're going to go back because we were so fortunate to get it in middle and high schools last year with athletic departments, but we would love to see it in elementary schools.
Absolutely. I mean, they do their own activities as well.
Yes.
And like you said, my big thing was, you really pointed out something I think very important, is visitors to the building.
Yeah.
Because anybody, who's coming in to visit, we don't know what their background is. We don't know if they have any heart issues or anything like that. And if someone drops of cardiac arrest as a visitor, you'd like to know that there would be people who would know what to do in that situation. I think that's a great aspect to look at, that it's not just inside the school, it's the people coming from the outside as well.
Yes, exactly. It's a community plan.
Really, exactly. It is a community plan.
My daughter's schools, they have grandparents' days or family days.
Right.
And so we don't know always what's going on. And so it's so important to be prepared for all members of our communities. And so we do see cardiac events happening in elementary schools.
We do, unfortunately,
we have
yes.
wonderful advocates who share their stories. And so that's what we're going back this year to ask for, is so that not just athletes, but everyone who visits an elementary school is protected by these plans.
And we've even seen, with our with our community impact director, Holly Mitchell, we've seen a couple of local businesses here in Charleston that have picked it up. WCHS TV8 has developed their own, and Link, who we've partnered with the rideshare stuff, they've developed their own internally because they saw the value of that. They were like, it's important because here's the thing, it's not something that you'd think about, but if our drivers are out in the field and someone in the back goes into cardiac arrest, they would know what to do. They would know to call 911. They would know to start doing CPR and how to do it. It's those kinds of things that you don't think about, that outside the box kind of concept, but it just goes to show that any business really would benefit from having a CERP. Like, I don't think it's something that should even just be like looking at schools. Like, if your business thinks this is interesting, take it on.
Exactly. As you said, our community impact director, Holly Mitchell, is phenomenal.
She is, man.
In working with our local businesses and with our universities.
Yo, absolutely.
To get these policies in place. And once you have the policies, it's not a heavy lift.
No, it's not. It's really not.
You can adapt it as you need, as your staff grows or shrinks.
Yeah.
And it's like you said, it's making sure you're protecting employees and visitors, just like we know where our exits are at our offices, or knowing any safety measure that we have in place, or an HR policy, even to keep our employees safe.
Well, you nailed it. I thought when you compared it to a fire drill. I mean, like, you do fire drills, so why would you not just kind of like do a plan? Like, if something happens, who's in charge of this? Who's who's doing this? Who's doing that? Who's getting this? Who's getting that? That is such a simple concept, but it is, again, like, it's amazing how many businesses don't have those kinds of things. So it's a great concept. I mean, like, honestly, we've heard nothing but good things from WCHS and Link. They were so happy to be able to do that, and now they have employees who, if something were to happen, I mean, you think about it from a news standpoint, right? Like, their guys are going out into the field all the time, right? But they also have guests coming in to be on the news. So, like, if something were to happen to someone there, they have an AED now. They have someone that knows how to, which is so great they got the AED. Like, they now have that plan in place in a business, and I'm just like, man, it just feels like every business should look into a CERP, because it is just one of those things of, it's like that adage, you'd rather have a gun and not need it than need a gun and not have it. Right. I've always said, when it comes to CPR or anything like that, I would rather learn how to do it and have an AED and have all that in play and never have to use it than watch someone I know and love drop and not know what to do.
Exactly.
And I think that's really a big key component.
It is. It's being prepared and hoping to never need it.
Right.
And we're also seeing more folks getting trained in CPR, which is
the Nation
incredible.
of Lifesavers, yes. What a wonderful thing. Like, Damar Hamlin, his accident, if it did anything, it got people thinking about the need to know CPR.
Exactly. And we are doing that. We are building our Nation of Lifesavers.
Yes, we are.
Whether it's hands-only CPR, if it's fully trained in CPR, if it's understanding the differences between cardiac arrest and other cardiac incidents, and the response and the different needs there. there. So yeah, we are absolutely building our nation of lifesavers here in West Virginia and across the country.
Now, obviously, the legislative session's coming up, so I know that we'll be looking at CERPs.
Yeah.
What are some of the other things that you'll be looking at, like this upcoming session?
So one of our major priorities is nutrition security.
Yes.
We have worked with our local farmers markets and our local food and farm coalition, and they are advancing a goal of expanding their SNAP Stretch program.
What a wonderful way to use that too.
Yes,
like, what
exactly.
A great, especially with our farmers markets that are like, there's one in every county. Like there's so many farmers markets. Like there's tons.
Yes, and this is truly an economic multiplier for our local farmers,
right?
For our local farmers markets. You know, it's a 1-to-1 or 1-to-2 or 1-to-3 match depending on the demographics of the participants. But our farmers markets really use that to grow and to know how much produce they need to use each season, and it's a really successful program, and so we're working in collaboration with them. It provides not just food to our local communities,
sure,
but nutrition,
yes,
which is huge when we're looking at cardiovascular health, when we're looking at stroke prevention. When
you look at so many parts of the state that, like, you know, they don't have access to like all these like the fresh fruits and vegetables, but they can find McDonald's, you know,
right.
Like that is one of those things we're definitely looking at when it comes to these communities. And the farmers markets, I mean, if you want to talk about the very definition of farm to table,
yes,
that is the great thing about a farmers market is when you go to buy at that farmers market, you are buying from someone from right there in your community. You are literally supporting your community,
yes,
and you're bringing home fresh fruits and veggies for your family that were literally grown by someone right there in your neighborhood. And I think that's such an amazing thing, and it's such a great, like, it's such a great Appalachian thing, right? Like,
right.
I mean, in West Virginia, I always joke that we're not really a state, we're one kind of big neighborhood, right? And the farmers market is such a neighborly thing.
It is.
It's such a wonderful concept. And, you know, we're partnering with them we have a cookbook we're working on with them and stuff too. So it's like we've got a great partnership with the farmers markets, and I just can't express enough like what a resource they are. And I'm so glad to know that we're working with them on so many levels like that. And SNAP Stretch makes so much sense.
Yeah, it's a fantastic program, like you said, because it is Appalachian in nature.
It is.
You know, it's using those ingredients that are grown in your grandma's backyard.
Right.
It's meeting the local farmers, and it's taking that home to our families.
Yeah,
so,
you are literally buying it from the local farmer. Like, it's such a great concept.
Yes, exactly.
It's wonderful. Now, I know obviously that's a big. Are there any other policies that you're looking at moving and shaking this year?
We'd love to see self-monitored blood pressure coverage.
Yes.
Especially for pregnant and postpartum women. We know that cardiovascular issues are the #1 killer of pregnant and postpartum women, and so we would love to increase the survival rates there, and also just help moms and babies in our state.
Yes.
And so we would love to see some activity on coverage for an at-home self-monitored blood pressure cuff.
Yep.
It keeps them able to check their blood pressure at home. It decreases visits to the emergency departments.
Indeed it does.
And so we know that, like our EMS, we know that our hospitals are still strained. And so we want to help moms and babies stay safe at home and work with their primary care providers in that.
Well, and it's really a great thing because we've seen already, and again, we'll talk about Holly and her work with Community Impact, but like in various like more rural areas where they've incorporated these kinds of plans, people who didn't know they had high blood pressure suddenly found out they did.
Yes.
And they were able to keep a check on it, and they were able to get things in check, and they have seen such turnover from like high blood pressure to steady and stable blood pressure in so many patients. So we know that the home self-monitoring works.
Yes.
It absolutely does. There is absolute proof that it does. And as you said, when it comes to especially like with pregnant and postpartum, like that is such I mean, it's a wonderful time, but there are so many things going on in the body, and it is true. Cardiovascular issues are the #1 issue when it comes to those situations. I mean, as we know, cardiovascular disease is the #1 killer of women, period.
Right.
Full stop. Especially, though, in the pregnancy and postpartum because of the toll that takes on the body. We know that that's really, really important.
And the self-monitor blood pressure cuffs, having insurance coverage for those is really empowering to that new mom or that pregnant mom or to anyone. Like you said, our pilot programs with our rural health clinics have seen tremendous,
I mean, really amazing results honestly. Amazing.
And that, you know, every year at the legislature, we do a couple of, we invite medical professionals to come and do blood pressure screenings
Yes,
for anyone at the Capitol.
Yes.
It's for legislators. We love it when the governor comes, when the Speaker of the House, when the Senate President. And what we have seen, legislators and staff have come to us. They did not know how, they might know they had a high blood pressure.
I mean, they're
It's a
at the
stressful
legislature.
time.
Yeah,
Right.
it is. You're going to have it regardless.
We have very high numbers, but they might not know how high it was.
Right.
Or they might have, and so it was really incredible to have them come to us year one that we did it. They found out their blood pressure numbers. They found out their blood pressure was high. We said, talk to your primary care provider. They came back to us the next legislative session and said, hey, I've started monitoring my blood pressure. I've started working with my provider, and it's under control now.
That's great.
And I mean that is the work of the American Heart Association.
That is. It's work. Proof's in the pudding, man.
Yes.
It really is.
So we're doing 3 of those this year during the legislative
Wonderful.
session. Yeah, we'll do one at the beginning.
Yep. When you know it's going to be the highest, let's be honest, we know those numbers are going to be high.
And one at the middle, see how it's going, and one at the end. And so that's going to be February 13th, and then March 13th, which is our Go Red Day at the West
Yes,
Virginia
our lobby
Legislature.
day, yeah.
Yeah, and then one of the final days of session. And we like to compare those numbers over.
Yeah, absolutely.
See how they go up or down. And we'd love it if we saw more people go down from visiting
Yeah,
their
it would be nice
providers.
if the work in the legislature was so good that
Right.
people's numbers were just going steadily down and calm. That would be a
Right.
wonderful thing, would it
Yeah.
not? Well, you mentioned our lobby day, and I think that's such a wonderful thing because lobby day is a great day for our various advocacy committee members and stuff, and just volunteers to come out. And I've always loved that. Not only do they learn more about like what we're doing from a policy standpoint,
Right.
but they just learn more about the process, like how a
Yeah.
bill is passed, how a bill becomes a law. Like they really get to see it in action. So talk a little bit about Lobby Day, like how to get involved and what we'll be seeing that day.
Sure. So the best way to get involved with our advocacy efforts, Lobby Day, or any of this other work we've been talking about, is to register at You're the Cure.
You'reTheCure.org.
Yes.
It is, I mean, the wonderful thing about You'reTheCure.org, it's free. And the great thing about it is you get notifications about the things that you're interested in. If we're
Exactly.
moving policy that moves like that, and with the push of a button, just literally hit and click here,
Yes.
you can send a fully typed up, ready to go response to your proper legislator or
Right.
your proper government representative, and everything is done right there. It's so easy to have your voice heard, and let me tell you, we have talked numerous times with our elected officials. They get these emails. They pay attention.
They do. West Virginia is our legislators are very responsive to their constituents.
They are.
And
They
so
really
one
are.
of the best parts about Lobby Day is register at You're the Cure. You can get the information there. You can also just come on March 13th. But what is awesome, like you said, is people, maybe they know, maybe they had a relative that had a heart attack or
Sure.
something, and so that's drawing them to this work. They want to talk to their legislator about the difficulties they had reaching a hospital or how someone knew CPR and saved their life.
Right.
So it's a great opportunity to get to know your legislator. But as you said, it's also awesome for people to visit our beautiful state capitol building.
It is a beautiful building.
And it's awesome for them to learn the process of, how a bill is introduced and how they can contribute to that. And then the different hearing processes, the
Yeah.
committee process. And then what happens when a bill reaches the floor of the Senate or the House and how it has to go to the other chamber as well. So we love educating advocates on the process, and then we love empowering them to meet their legislator and get more involved in the entire legislative process.
Well, having your voice heard is always really important. And that's the great thing about Lobby Day is it really allows them to have their voices heard. Like they can literally talk to their representatives right there that day.
Yeah.
And that is something that we've always heard feedback from, that like that really mattered. Like in some cases they were like, I'd never actually met them before. So
Right.
this was the first time I'd really met the person that I've obviously I've voted for them, I've supported, but I've never had the chance to be in the same room with them, and now they've had that chance.
Yeah, West Virginia is unique in that our legislature is very accessible. I've learned a lot in my job about other state legislatures, and they don't all have offices in their state
No, they
capitol
do not.
building.
They
a
do
lot
not.
of folks are still virtual from COVID, but West Virginia is very much in person. All of our legislators have offices there at the Capitol, and for the 60 days, you can find them there.
You can, and thankfully it's not a year-round legislative thing, because
Right.
I've seen that, and I'm like, how do you even get through that? I have no idea.
Right.
Well, now if someone wanted to get involved, like I know you have like an advocacy, like a committee basically. Like, how does someone get involved on that level if they would want to step up and be a little more active beyond You're the Cure?
Yeah, so they can first register with You're the Cure and indicate their interest in becoming involved in that state advocacy committee.
Okay.
And so our state advocacy committee is wonderful, but we are always growing. growing it.
Yeah.
As we go into new policy areas, right now I'm looking for folks who want to work in elementary schools or have experience there, or also have experience in the nutrition security work. We could
Yes.
use a farmer or a representative from a farmer's market on our state advocacy committee. We can always use educators, folks working with our children, working with different vulnerable populations. But yeah, they can just reach out to us and we can have a conversation about their level of interest, whether they would rather do the work in their local community, whether they are great at making phone calls to legislators.
We love people who will do that.
Or if they want to show up at the Capitol during legislative session. We really have a variety of options so that it doesn't have to be super time intensive.
No.
But if it's your passion and you want to be there, absolutely, we welcome that as well.
Yeah, it's really great. Like, I love the fact that You're the Cure. It really, I mean, like, it is, we see it really big in West Virginia. Like the You're the Cure network in West Virginia, they respond, man. When we send out the call to action, they get on it. And it's so, again, it's so easy to do, and I cannot express enough. It is free. That is the most important word I'll put out there. It is completely free to join. We will not bombard you with phone calls or text or anything. Just when we know that something is coming up that you have indicated an interest in.
Right, you choose your interest
You
areas.
choose your interest. You will get something responding to that. So we're not going to be spamming you. You're not going to get, calls at 3 o'clock in the morning like, hey, go, hit this button. Like, no, nothing like that. As we're wrapping up, going into this session, you had such a great win last year with CERP. And of course, the great thing is, bringing CERP this year, the groundwork's already been done. They now know what it is. Our legislators fully understand, the importance of it, how it works. So it's not like one of those, what is a CERP?
Right.
What is your main hope, that we'll see this year at the session? What are you really pulling for your biggest win?
My main goal is to get those cardiac emergency response plans in elementary schools. It's all about protecting our community, like we talked about already, and it's just expanding it beyond the middle and high schools. So that is our overall goal.
Sure.
And also just advancing public health, protecting local control of public health, and making sure that all of our neighbors, all of our community members are educated in the best ways to prolong their lives, and just overall advancing the mission and vision of the American Heart Association at the legislature.
Well, I'm excited to see what you're going to do, and I know it's going to be good work. Emily, thank you so much for the time today.
Thanks, Kevin.
And we're excited to, of course, be with you for Lobby Day.
Yeah.
And excited to see what you'll pull off this year. I know it's going to be a great year for you. So
thank you so much.
Thank you for the time. Now, of course, as we've just talked about, if you have not joined the You're the Cure network, there is never a bad time to join, and you can join today by simply visiting you'rethecure.org. Within 5 minutes, you'll be signed up and ready to go. And if you want to be a part of our Lobby Day, again, you can reach out to us through the You're the Cure network. We will get you all the information that you need. And on February 13th, March 13th, if you would like to join us, we would be thrilled to have you there. It's always a great way to have your voice heard and to learn more about the process and to just be a part of the mission of the American Heart Association. Now, if you'd like to learn more about what we talked about today, again, you can always visit you'rethecure.org. And you can also find us on Facebook at facebook.com AHAWV. And you can also find us on Twitter and Instagram at AHA_WV. You can keep up with what we'll be doing, and we'll have plenty of photos and reels from Lobby Day, so you'll see what's going on there as well. But we would love to have you involved in any way, so please, if you have any inclination whatsoever, if you're an educator, if you work in farming, whatever it is, please see about joining the You're the Cure network and make your voice heard. Helping keep you informed on the Library Television Network, I'm Kevin Polly. Here's wishing you good health for a happy heart.